Good evening, everyone. I am Richa Sehra, founder and editor-in-chief, Responsible Hospitals. And as usual, I have always come up with a new topic with all of you. Today's topic is all about robotic surgeries. There is a big difference about the initial surgeries, and there are very big difference in the advanced surgeries which are happening in the gynecology department nowadays. I think it's very important for us to know about it, to understand what are the relevance, what has come new, and what is something which is brought up in everyone's mind. So we will be talking about it more in deep about Dr. Rahul Manchanda with me. He'll be joining with me soon and we'll be starting the session ASAP. So in case any of you get any doubt related to the same subject, you can just write it in the chat box. I'm going to quickly ask that questions out of it. So I'm just going to add him soon and we'll be starting the session. Guys, hope you can see me live. I hope in case you have any issues with the network and everything, you can actually just message me so that I can get an idea. Dr. Rahul, I've sent you a request. Probably, I think it's saying that you're joining it. Hello, Kunika. Hi, everyone. You can just join this session to understand more about it because robotic surgery is something which is new. And I think it's very important for us to understand the relevance of it. Hi, Anamika. Thanks for being with us. Thanks for your all patience and thanks for the love you guys always do. So, Dr. Rahul, I can see that the request has been sent to you, but you are unable to join it. Just try joining it ASAP. Good evening, Dr. Rahul. How are you doing? I can't hear you. Hello? I can see you, but I can't hear you. Can you check the sound, please? Or maybe you can just rejoin it. We can't hear you at all. Guys, probably he'll be joining back in a minute or so since there was no sound at all. And I think that's going to be difficult for us to do session without any sound. So let's redo it. Wait for a minute and probably by the time he joins us back, you guys also will be ready. Yeah. Good evening, Dr. Rahul. How are you doing? Can you hear me now?
Hello, can you hear me now?
Yes, I can. I can.
Okay,
It's just
excellent. I
that
can
your
hear you
face
also.
is not very much visible. Yeah.
Okay, now I'm actually using the mobile phone.
That's all right. You can just keep it at some place and then we can quickly start.
Okay, is this better?
No, the it has been revolved actually. Yeah, now it is fine. It is better now.
Okay.
Quite good. So, doctor, since this topic is quite new to the market, a lot of people are not even aware that what robotic surgeries are and how are they making any relevance and importance in the field of healthcare industry and under gynae departments. So, to start with, I think I'm going to quickly ask you like, what are robotic surgeries and what is robotic surgeries?
Okay, so first of all, let me thank you and let me thank you thank the whole team at Responsible Hospitals, Sapna ji, who always never forgets to invite me if I've done something. So very kind of you all, and it's really nice to see all the wonderful work that you're doing.
Thank you so
Uh,
much.
Now, coming back to the topic that we're talking about today, I would also like to say you've asked me about what exactly is robotics. Well, it's basically technology which is moving forward, and you must have heard the recent terms about AR and VR, which is augmented reality and virtual reality. So
True.
all these things are coming into play now with technology coming into play, and actually robotics has been there for a long time. In our country, it has been there for some time, but there have been newer developments. One of which has been this new robot that has come in. Essentially, what it does is it uses machine technology, which is much finer, to do what a human would do, but the commands are given by the human, and that is the surgeon. So that's what you're doing here. It's a step ahead, a different type of technology, and with time only will we get to know whether AR, VR, which is now being introduced, as in robotics, there are selected indications for this surgery, but it's definitely an advancement uh, with technology in the field of surgery.
Sure, sure. So these options are available everywhere or at some places, if you can talk about some places wherever it is there.
Okay. Now, first of all, I must, of course, thank my hospital where I am practicing, which is PSRI Hospital, because of which, really, the people, you have to have a vision, and that's what it's all about. And this hospital has a vision. I've been there now for 8 years almost. So, this technology really, like I said, has been available for some time, but the robots have been continuously being changed and upgraded. This particular robot that is now that I have just trained on, and the technology has been there or introduced only about 2 years ago. So you would say just about in the year of the lockdown, which is, or just before that it was introduced here. It's been here for the last 2 years. There are only about 10 units worldwide, or 10, 11 units worldwide of this particular robot, which is a little higher end, that are available. In India, actually, there are more units than rest of the world. England has 3 units, and in the rest of the world, there are only about 6 units of this particular robot. So it's available only in selected places and not all over. And there are very few people who are actually trained on this.
Yeah, absolutely. Because this is something which people are not even aware about it, I think.
Yeah.
So I think it's very important for us to create awareness about new subjects and all. Because robotic surgeries is a term which people might have heard it, but they're not sure that how it's going to play a role actually, or how is it
Mm.
implemented in the reality. So what are the, I would say, how robotic surgeries, options can support in gynecology?
Well, gynae is again a surgical branch. You have gynecology and obstetrics. Obstetrics is the part of the babies and deliveries, and you do a lot of programs on that, I know. But gynecology is the actual surgical part of ladies' health or women's health. So it's obstetrics and gynecology. And gynecology would deal with anything from bleeding problems, tumors, you must have heard of endometriosis, uh, infertility problems. So those will come under gynecology. And in gynecology, robotics does have a part to play. Like I said,
Mhm.
it's a different approach of doing a particular surgery. You could do a similar surgery in another method, which could be by traditional methods, which is giving an open cut on the tummy and then doing the surgery. You could do it by minimally invasive techniques, which is laparoscopic surgery or hysteroscopic surgery, and then that approach can also be in robotic surgery. So you can use it for various pathologies or various problems that women have to treat it. So any of those could be treated by robotic surgery.
And how are they different from the other departments, the robotic one, particularly under gynecology?
Well, other departments, as in you're looking at other specialties or other
Yeah,
methods of doing surgery.
methods of the surgeries.
Okay, so methods of the surgery, like I said, you can do open traditional surgery where you have a large cut on the tummy of.
Mhm. Your voice is gone. Yeah, it's back. It's back. Yeah.
traumatic. So it's much more traumatic for the patient. The recovery time is much longer. Now, in laparoscopic surgery, which is minimally invasive surgery, the recovery time is shorter. So you have all the same advantages that you have for laparoscopic surgery, but with robotics, what happens is it's a little more precise. It's more precise because you have a machine which
Doctor
can move.
Ajit, yeah, I just got
Okay.
lost. I lost it.
Okay, so you have a machine which can move in millimeters, which is guided by the hands of the surgeon instead of actually the surgeon doing the surgery. So the precision is much more. But the most important factor is the fact that the surgeon, it's much better for the surgeon, it's easier for the surgeon to do rather than do what we call minimally or laparoscopic surgery because the comfort, the ergonomics is much more for the surgeon. And if you're more comfortable when you're doing your surgery, obviously your quality should improve by and large. But having said that, the older robots, you actually had to have a headgear and you look into it and you sit. So they were not so ergonomic for the doctor or the surgeon. This one is like sitting in front of your computer and you don't have to have a headgear, you don't put your head anywhere. It's you can have it in three-dimensional view, which is again an added advantage. So you have you can two-dimensional is where you see the picture on a flat screen, so you don't have depth perception. In this you can have it in three-dimensional where you have depth perception of the tissues also, plus ease of operating. The surgeon doesn't really have to scrub up and wear a heavy gown and all. He's sitting at a console and he's operating and doing very fine movements which are then transmitted to the robot and it moves. So you can do the same job with laparoscopy, but it would be a little better for certain surgeries, definitely. You would not apply it for all surgeries in gynecology, but definitely for surgeries where you need more precision, it would be a good option to use for the ladies.
Sure. So, does the people also found any specific difference they understood about it? People who have actually gone through it.
We need to get out more information about it. We need to tell the advantages of this surgery. You don't use all surgeries, sorry, all or this method to do all surgeries in gynecology. You
Right.
have to do certain surgeries by this which are more which need more precise movements, because it doesn't make sense using this. After all, there is a cost factor to this also. So you would use it maybe in cancer surgeries or for doing tuboplasties and infertility surgeries. We have a robot which has now been approved by the FDA, which has not come
Oh,
into the market, and it is not this robot, but you can do vaginal surgeries with it also. So again, the movements are more precise with it, and it's newer technology that is being used to see if it can be or can give us better results, for women's health.
so if you can tell more about what kind of robot and I would say techniques which are used for this kind of
Okay.
surgery.
So the robot that is used is, like I said, it's there's a console on which the surgeon sits, and there is a screen like you have your screen in front of you on the computer screen.
Right.
The surgeon sits in front of it, and uh, it can be you can use it as 2D or 3D surgery. 3D is better, like I said, because it gives you depth perception. So you have to wear your 3D glasses, which as you go in a movie and
Yeah.
watch a movie just like that.
That's what
And
I'm trying to imagine.
so actually you're sitting and you're operating on a stool. You can sit or stand depending on what your comfort level is for the
Okay.
surgeon. And it's good for long surgeries because uh, like I said, you're not uncomfortable, you're not stressed, you don't have a gown on you, you're not standing over a patient and operating,
Yeah.
you're sitting in one place. I mean, I shouldn't be comparing it to it, but you're really looking like you're playing Xbox or you're actually sitting on a computer and doing precise movements, really is how I would compare it. Um, uh,
Okay.
and with great comfort and ease for the surgeon, even in longer surgeries.
Sure. So I'm going to pick up a question somebody asked. In terms of patient side, how the mode of surgery is going to affect like expenses, recovery time, post care. Okay. So she's asking in terms of patient side, how this mode of surgery is going to affect like expenses, recovery time, and post care.
Okay, so I think she's asked a lot of the questions that one should answer. And let me take the most uncomfortable question first, which is about the expenses. Uh, Definitely, the expenses are much more than traditional surgery, or for that matter, even traditional laparoscopic or minimally invasive surgery. So your expense would be almost to the tune of maybe a lakh of rupees more, but it would come down with time. I remember when laparoscopic surgery was started many years ago, and one of the pioneers in that field was Dr. Chaube, who many people must have heard about. And many of the senior surgeons said that it's not going anywhere, and traditional surgery is the way to go, and it's very expensive, the equipment is expensive, and the costs were higher. With time, all those have come down because you have now reusable instruments. You have don't spend on the whole stack of instruments. So things come down with time once the applications increase and as time goes by. So I'm sure this is what will happen with robotic surgery also. Now, coming to the benefits that the patient would have,
Yeah.
and the benefits that the patient would have would be essentially definitely a better result in certain types of surgeries where you need more finer surgeries, which, for example, if I was to do a tuboplasty, which is a rejoining of the tubes for fertility, or if I was to do, there is a lot of application in urological surgery where you have, prostate removals that will help. In women, you have cancer surgeries where you can remove much finer tumors with with more precision, because the camera and in this control is with the surgeon, and the
Right.
depth perception is there. You can go in much deeper. So and actually the robot, this one has got 4 arms to it. You can put 6 also, and it's like a surgeon. You have the arms bent in this fashion, and there are joints where you get the whole rotation 360 degrees, which you can't get in a normal, if a human is doing it, so to say. So the
Mhm.
precision is much more. There are indications for it. For example, like I said, in women, cancer surgeries, lipoplasties, even hysterectomies, or doing removal of fibroids, where you can have better precision for suturing of the uterus, stitching of the uterus. You do need studies which will need to be done to see whether actual long-term outcomes are benefited or not. But definitely, it does help in all the surgeries that I've mentioned in women.
Awesome. That is actually informative. Very, very different kind of thing which I'm getting to know. So cool. Somebody's asked that what are the charges of this kind of surgery?
That I think we've already dealt with.
We
The
have already
charges.
clarified that. Yeah, yeah, yeah. I'm just think. Yep. Nice session and all. Okay, thanks. So another question to you is that I'm sure how did your training go while taking such training of robotic surgery? Because I'm sure that could have been a different experience altogether.
Oh, yes, of course. It was wonderful. We have a training center in Goa where I went to train, and I was just saying that I was very lucky because just after I left, the cases started to rise, and uh, now, of course, it would have been difficult to go, but we had a very
Yeah.
compact, very busy schedule. We would go there and train from literally 8 in the morning to 5, 6 in the evening, with maybe just a working lunch in the middle and a cup of coffee every now and then. But they were very professional, and the best part was each one of those trainers were young, uh,
Oh,
probably half my age, and it was
awesome.
wonderful to learn newer technology from them. I've learned all over the world, and I'm one of those people who enjoys learning new technologies, new methods, so that we can bring them here for our, ladies here and improve women's health. So it was wonderful. It was actually, we had gone from, again, I mentioned my hospital, which has the vision for it, which was PSRI or is PSRI hospital. We went as a team. They sent us. So they sent two surgeons. There was a general surgeon, Dr. Chore, who went with me. Then there were two team members, and we have to work as a team in order to learn the functioning of the robot. So you do everything together. So it was teamwork that we learned of how to gel together, how to use it to the maximum benefit. So it was a wonderful experience, I must say, and I must thank them, which is the CMR Surgicals, who's robotics. So it's actually a Cambridge company which is in England, and they have their center here. And it was funny because we have more robots here, so our people who are training here give them more information of how to train, and the troubleshooting to the people back there in England. So it's wonderful, I must say.
Sure, that's really awesome to know about all this. These and advancements can change the scenario of things we look at in India.
You need to repeat your question. I think I missed you.
And like that, since these are a lot of developments which are happening, there are a lot of advancements. We are coming up with a lot of different kind of stuff. Advanced, you said, robotic surgeries. How can they change the scenario of looking at things in India?
Well, it's another method, like I said, of doing surgery, and surgery is part of treating a woman who has a problem, whether it's in endometriosis or for fibroids or for cancer, in order to better the basic health of women in our country. And we all know that if women progress, any country,
Yeah,
it's something that you can't, I mean, you disregard women's health at your own peril or at the country's peril. So it's another method of treating. It's another method of improving, trying to improve women's health. You have to have what we call a basket or a cafeteria approach. You have different methods for treating different problems in women. It's not that one thing, is applicable to everything or can do everything. So you need to have different modalities for treating different problems in women. And this is another modality which is an advancement, and hopefully will give better results to various procedures being done, and thus improve women's health in general. So, obviously, the best thing for women's health is, like we've spoken before, is prevention. You
right.
need to prevent diseases. But if you do get something, then various is robotic surgery.
Sure, of course. Is robotic surgery will be helping in cervical cancer treatment particularly?
Oh, yes, absolutely. It is definitely going to help in cancer cervix treatment, the surgical part. So, if it's in early stage, then to do the proper removal of the cancer, the tumor, as well as the uterus and the nodes and all, it will definitely help with cancer cervix treatment. Yeah.
Awesome. Then I have another question. Do this method have any side effects or anything? What should we know?
Well, as in any procedure, any surgical procedure, there are complications that can happen. This method has the same complications. Indeed, in fact, there are many safety measures that have been given in the robot. So, actually, if there's a problem, the whole thing will stop working and there won't be any harm to the patient. So you can then remove everything and do your traditional surgery. So it has many safety alarms so that all are focused towards patient and so that there is no harm for the patient caused.
Sure. It was really great, Dr. Rahul. Anything else separately which you want to add on to this, which I missed out? Anything related to it?
Well, we've spoken about the various, what exactly the technology is, how it can help the surgeon and the patient, of course. We spoke, which is also important. We've spoken about the ease of
Yeah.
surgery, the ergonomics, um, and
Yeah.
more importantly, to get the message out there. There are very few units. Of course, our hospital, you need to have the vision, and that's what our hospital brings to the table. And we hope it will definitely, I'm sure, be helpful to women who need this particular method of treatment.
Sure. Someone asked again that I'm suffering from battle cyst from more than 4 years. Also, I had four surgery. Nothing worked for me. Can this help for me?
Okay, so this is not surgery to be used for a Bartholin cyst. A Bartholin cyst is outside and is caused down below in the vagina, so not to be used at the moment for that surgery. This is for surgery that is done inside the tummy, which is on the uterus, the ovaries, the tubes, and all that. So not for Bartholin cysts.
Sure. Do you think people are going to rely on robotic surgeries than other methods?
Well, I think it's going to be one of the methods to use. I don't think it's going to replace everything completely, but it's definitely going to be one of the methods to use. And in future, we've just used in our hospital, that is PSRI hospital, AR and VR for the first time ever in the world. It has been used in gynecology, and we've used it. So maybe with a combination of all this, that I think is the future of surgery in that direction, which is augmented reality and virtual reality. And again, in our hospital, uh, anywhere in the world, this has been used first in gynecology. Nowhere else has it been used.
That's really amazing, and I think I would really want to add on to this that it's to the people, they always take time to adapt something new. But once people try and test it, they experience it, they find wow, and then other people move and follow them.
Yeah.
So I think this is how people take it, anything, whatever comes up. So thank you so much, Doctor. I think I'm done with my all the questions. It was really great and informative, something new which we have learned. So thank you so much for being with us.
Thank you, Richa. Thank you to the whole team. And it was a pleasure to talk to you again. And I look forward to seeing you again. Keep doing
Sure,
the
no
good
problem.
work.
Done. Thank you so much. Thank you. Thank you.
Bye.
Bye bye.
Bye.